My name is Basil Kotakal John. I'm a third year nursing student here to discuss about the importance of infection control and management through this narrational video presentation. This is an overview slide showing the contents that will be discussed in this presentation. Infection control and management involves providing safe patient care by minimizing the risk of infections associated with hospital admission. Hospital-acquired infections affect many hospital admissions in Australia each year. It is said to have increased risk in morbidity and mortality, as well as increasing the chances of readmission within a year. About 60,000 patients were affected by hospital-acquired infections in 2015-16 alone, resulting in 1 in 74 hospital admissions the same year. The main aim of this presentation is to establish the importance of maintaining a healthier workplace environment using various infection control strategies and hygiene mechanisms supported by peer-reviewed literature. This module provides important information about patient safety requirements and the importance of leadership initiatives by targeted audience, that is, the nurses, specifically the new graduate nurses. Infection control and management is a collective responsibility of all employees working in a healthcare setting. The current infection control management strategies involve proper hand hygiene practices, wearing adequate PPE or personal protective equipment, using the aseptic technique for wound dressings or other surgical procedures, appropriate isolation strategies based on the mode of infection transmission, and documentation of all findings and observations related to infection control and management. Hand hygiene in healthcare came into practice during the 1980s. In 1846, a Hungarian doctor, Ignaz Semmelweis, noticed that mortality rates of both mothers and infants in a maternity ward reduced significantly after healthcare workers adopted hand hygiene practices. He is also known as the father of hand hygiene. Hand hygiene can be done using two methods. Alcohol rubs if hands are not visibly soiled, and using soap and water when they are visibly soiled or when there is a risk of body fluid exposure. The 5 moments when hand hygiene should be practiced includes before and after entering a patient's surroundings, before and after touching patient's surroundings, after a body fluid risk exposure. Another thing to keep in mind is to use soap and water only when entering a patient's surrounding who is infected with a microbe that cannot be destroyed by alcohol hand rub, like Clostridium difficile. Personal protective equipment, or PPE, is an equipment worn by healthcare workers as an infection control measure, reducing the risk of transmission. PPE contains a pair of gloves, protective gown, goggles or face shield, face mask. It is important to use PPE correctly when there is a risk of exposure to infections and when there is a risk of body fluids. This involves using the correct equipment as well as donning it and removing it correctly. Aseptic wound technique involves the practice of using procedures that prevent contamination by pathogen and thereby reducing the risk of infection transmission. It is mainly followed when dressing wounds or any surgical procedure to prevent the risk of infection to the site. Aseptic technique involves following the institution's policies and guidelines regarding wound dressings, hand hygiene, using personal protective equipment, maintaining an aseptic field, using adequate wound dressing for faster healing, documenting the findings. Isolation procedures involves the separation of a patient's surrounding based on the mode of transmission of the infection. Depending on the mode of transmission, the isolation precautions are as follows. Standard precautions, which applies to all patients. Contact precautions, which involves the healthcare worker using adequate PPE to prevent risk of cross-contamination by avoiding direct contact with the patient's surroundings. Droplet precautions involves the use of adequate PPE and infection management to prevent the risk of infections that spread via droplets traveling less than a meter. Airborne precautions involves the use of adequate PPE and infection management to prevent the risk of infections spread via droplets traveling more than a meter. Documentation basically refers to the vital role of communication that plays a part in infection control. Putting up infection control brochures in patient surroundings, putting up a precaution sign and instructions on how to wear PPE, as well as how to dispose PPE in the doors of the infection isolation rooms. Handing over the current infection control management for the patients and documenting them in the progress notes is also essential. Not many nurses are taking the necessary steps associated with infection control management. Improper hand hygiene practices and lack of compliance to proper hand hygiene measures have also contributed to the hospital-acquired infection rates. The current average compliance rate for hand hygiene is 85.3% in Australian hospitals. There are evidence suggesting that nurses are not complying to the PPE requirements due to time restrictions. This also includes improper practice of donning and removing PPE, not wearing enough protection that is recommended as per the guidelines and policies, lack of proper communication between healthcare workers have increased the risk of infections for both patients and the healthcare workers. Furthermore, a lack of knowledge about the proper infection control measures among clinicians are also a challenge to the infection control management. What is required by nurses? Communicating any infection control measures required adequately during handover and documenting this in progress notes. Following proper hand hygiene practices and wearing adequate PPE as per requirements. Following policies, guidelines associated with infection control to reduce incidences of hospital-acquired infections, taking adequate precautions when there involves a risk of infection, using aseptic technique when dressing wounds to prevent cross-contamination, educating everyone, including clinicians and visitors, about infection control measures to improve health outcomes. Legal and ethical responsibilities as a new graduate nurse. Following policies are mandatory, and there are infection control management policies and guidelines in place to abide by as a healthcare worker. Providing a safe and appropriate care to the patients as part of Standard 6 of the NMBA Registered Nurse Standards of Practice. Ethical responsibilities like beneficence and non-maleficence, duty of care obligations as part of NMBA Code of Conduct for nurses, expressing leadership qualities like transformational leadership and teamwork, as well as showing moral courage in appropriate situations. In conclusion, infection control management helps improve the quality of healthcare. Clinicians following various infection control strategies, as explained in this module, can help reduce the risk of associated infections, hospital-acquired infections. Nurses taking collective responsibility and showing leadership qualities in improving healthcare outcomes and reducing risk for patients by showing initiative where necessary precautions are required, as well as following the ethical and legal responsibilities as a part of reducing infection risks in hospitals to promote a better health outcome. That's all. Thank you.